Hello, nursing students. Welcome to our channel, Nursing Exam Preparation. In this video, we'll walk you through the top 200 pharmacology true or false questions and answers, each paired with a detailed explanation to help you fully understand the concepts. This comprehensive guide will support your nursing exam preparation, ensuring you are well-equipped to tackle any pharmacology-related questions that may come your way. Feel free to watch the video as many times as you need. Repetition is key to mastering the material and boosting your confidence. Whether you're just starting to study or doing a final review, these questions will test your knowledge, challenge your critical thinking, and reinforce key pharmacological principles. Don't forget to like this video, share it with fellow students, and subscribe to Nursing Exam Preparation to stay up to date with all of our latest content. Click the bell icons so you never miss a video that can help you succeed in your nursing exams. Let's dive into the world of pharmacology, sharpen your skills, and get ready to ace your exams. 1. The nurse should administer insulin before meals to manage blood sugar levels. True or false? Answer: true. Rational. Insulin is typically administered before meals to manage blood glucose levels, ensuring that insulin is available when blood glucose levels rise after eating, preventing hyperglycemia. 2. Diuretics are contraindicated in patients with hypertension. True or false? Answer: false. Rational. Diuretics are commonly used to treat hypertension by reducing fluid volume and lowering blood pressure. They are not contraindicated unless the patient has specific conditions like renal failure. 3. Beta blockers can be used to treat hypertension but are contraindicated in asthma patients. True or false? Answer: true. Rational. Beta blockers can lower blood pressure but should be used cautiously or avoided in asthma patients due to their potential to cause bronchoconstriction. 4. Antacid should be taken immediately after meals for maximum effectiveness. True or false? Answer: false. Rational. Antacids should be taken 1 hour after meals to neutralize stomach acid effectively, especially when it is produced in response to food. 5. The use of grapefruit juice is contraindicated with statins. True or false? Answer: true. Rational. Grapefruit juice inhibits the cytochrome P450 enzyme that metabolizes statins, potentially leading to dangerous increases in statin levels and increased risk of side effects such as muscle damage. 6. Patients taking ACE inhibitors should avoid high potassium foods. True or false? Answer: true. Rational. ACE inhibitors can increase potassium levels in the body, so patients are advised to avoid potassium-rich foods to prevent hyperkalemia. 7. Insulin is the only medication used to manage type 1 diabetes. True or false? Answer: false. Rational. While insulin is the primary treatment for type 1 diabetes, other medications like amylin analogs and SGLT2 inhibitors may also be used in some cases. 8. Warfarin therapy requires frequent monitoring of PT/INR levels. True or false? Answer: true. Rational. Warfarin affects clotting and requires regular monitoring of PT/INR to ensure therapeutic levels and prevent bleeding or clotting complications. 9. Beta blockers are effective in controlling both heart rate and blood pressure. True or false? Answer: true. Rational. Beta blockers block beta-adrenergic receptors, reducing heart rate and blood pressure, making them useful in conditions like hypertension and arrhythmias. 10. The nurse should withhold digoxin if a patient's heart rate is less than 60 beats per minute. True or false? Answer: true. Rational. Digoxin can cause bradycardia, so the nurse should withhold the medication if the heart rate is less than 60 bpm to avoid further lowering the heart rate. 11. Taking aspirin with alcohol significantly reduces the risk of bleeding. True or false? Answer: false. Rational. Combining aspirin with alcohol increases the risk of gastrointestinal bleeding due to the combined irritant effects of both substances. 12. Statins are contraindicated in pregnant women due to their potential to cause birth defects. True or false? Answer: true. Rational. Statins are classified as pregnancy category X and should not be used during pregnancy due to the potential for birth defects and fetal harm. 13. Antibiotics such as penicillin are effective against viral infections. True or false? Answer: false. Rational. Antibiotics, including penicillin, are only effective against bacterial infections and have no effect on viral infections like the flu or common cold. 14. Levothyroxine should be taken on an empty stomach 30 to 60 minutes before breakfast. True or false? Answer: true. Rational. Levothyroxine absorption is improved when taken on an empty stomach, as food can interfere with its absorption. 15. Methotrexate is used to treat autoimmune diseases, but requires careful monitoring for liver toxicity. True or false? Answer: true. Rational. Methotrexate is commonly used for autoimmune conditions but can cause liver toxicity, so liver function tests should be monitored regularly. 16. Non-steroidal anti-inflammatory drugs, NSAIDs, are safe for long-term use in patients with renal disease. True or false? Answer: false. Rational. NSAIDs can cause renal impairment, especially in patients with existing kidney disease, and should be used cautiously or avoided. 17. The use of corticosteroids increases the risk of osteoporosis over time. True or false? Answer: true. Rational. Long-term use of corticosteroids can decrease bone density, increasing the risk of osteoporosis and fractures. 18. Vancomycin is commonly used to treat infections caused by gram-negative bacteria. True or false? Answer: false. Rational. Vancomycin is primarily effective against gram-positive bacteria, not gram-negative bacteria, and is often used for infections like MRSA. 19. Antihistamines should be used with caution in elderly patients due to the risk of confusion and sedation. True or false? Answer: true. Rational. Antihistamines can cause sedation and confusion, particularly in elderly patients, and should be used with caution in this population. 20. Antibiotics should always be taken as prescribed, even if symptoms improve before completing the full course. True or false? Answer: true. Rational. Stopping antibiotics prematurely can lead to incomplete treatment, bacterial resistance, and relapse of infection. 21. A higher dose of acetaminophen is more effective for pain management in patients with liver disease. True or false? Answer: false. Rational. Acetaminophen should be used cautiously in patients with liver disease, as high doses can exacerbate liver damage. 22. The primary action of proton pump inhibitors, PPIs, is to reduce gastric acid production. True or false? Answer: true. Rational. PPIs block the proton pumps in the stomach lining, reducing gastric acid production and helping treat conditions like GERD and ulcers. 23. Antidepressants should be stopped abruptly if a patient feels better. True or false? Answer: false. Rational. Stopping antidepressants abruptly can lead to withdrawal symptoms and relapse of depression. A gradual tapering process is recommended. 24. Benzodiazepines can cause physical dependence with long-term use. True or false? Answer: true. Rational. Benzodiazepines can lead to tolerance, physical dependence, and withdrawal symptoms if used for prolonged periods. 25. Patients on warfarin should avoid eating foods high in vitamin K. True or false? Answer: true. Rational. Vitamin K can interfere with the effectiveness of warfarin, so patients are advised to maintain consistent intake of vitamin K-rich foods. 26. Acetaminophen is safe for long-term use in patients with chronic pain. True or false? Answer: false. Rational. Long-term use of acetaminophen can cause liver damage, especially in high doses or with alcohol use, so it should be monitored carefully. 27. Antacids should be taken at least 1 hour before or 2 hours after other medications. True or false? Answer: true. Rational. Antacids can interfere with the absorption of other medications, so it's recommended to take them at least 1 hour before or 2 hours after other drugs. 28. Insulin should always be administered using a syringe or insulin pen, never by oral route. True or false? Answer: true. Rational. Insulin is not effective when taken orally because it is broken down in the digestive system, so it must be injected. 29. The nurse should monitor potassium levels closely when a patient is receiving furosemide. True or false? Answer: true. Rational. Furosemide is a loop diuretic that can cause potassium loss, requiring regular monitoring of potassium levels to prevent hypokalemia. 30. A patient who is allergic to penicillin can safely receive cephalosporins. True or false? Answer: false. Rational. Cephalosporins have a similar structure to penicillin and can trigger allergic reactions in patients with penicillin allergies, so they should be avoided or used with caution. 31. Theophylline is used to treat asthma and requires monitoring of blood levels to avoid toxicity. True or false? Answer: true. Rational. Theophylline has a narrow therapeutic range, so blood levels must be monitored to prevent toxicity, which can cause seizures or arrhythmias. 32. When administering oral medications to pediatric patients, the nurse should crush all pills to make them easier to swallow. True or false? Answer: false. Rational. Some medications should not be crushed, as this can alter the effectiveness or cause adverse effects. Always check if a medication is safe to crush before doing so. 33. A patient taking warfarin should avoid drinking grapefruit juice. True or false? Answer: true. Rational. Grapefruit juice can inhibit the metabolism of warfarin, increasing its effects and raising the risk of bleeding. 34. Phenytoin should be taken with food to avoid gastrointestinal irritation. True or false? Answer: true. Rational. Taking phenytoin with food can help reduce the risk of gastrointestinal irritation, which is a common side effect of this medication. 35. If a patient is allergic to sulfa drugs, they can safely take thiazide diuretics. True or false? Answer: false. Rational. Thiazide diuretics may contain sulfa components and can cause allergic reactions in patients who are allergic to sulfa drugs. 36. Anticholinergic medications can cause dry mouth and blurred vision. True or false? Answer: true. Rational. Anticholinergic drugs block acetylcholine, leading to side effects like dry mouth, blurred vision, constipation, and urinary retention. 37. Long-term use of corticosteroids can lead to elevated blood sugar levels. True or false? Answer: true. Rational. Corticosteroids can increase blood glucose levels, which may be problematic for diabetic patients or those at risk of developing diabetes. 38. Non-steroidal anti-inflammatory drugs, NSAIDs, are safe for patients with peptic ulcer disease. True or false? Answer: false. Rational. NSAIDs can irritate the gastrointestinal tract and exacerbate peptic ulcers, leading to bleeding or perforation. 39. The use of diuretics may cause hyperkalemia in some patients. True or false? Answer: false. Rational. While some diuretics, e.g., potassium-sparing diuretics, can cause hyperkalemia, most diuretics, like loop or thiazide diuretics, tend to cause hypokalemia. 40. Inhaled corticosteroids are effective in managing acute asthma attacks. True or false? Answer: false. Rational. Inhaled corticosteroids are used for long-term asthma control, not for acute attacks. For acute attacks, short-acting beta agonists are more appropriate. 41. Metformin is contraindicated in patients with renal impairment. True or false? Answer: true. Rational. Metformin is contraindicated in patients with renal impairment because it can lead to lactic acidosis, a potentially life-threatening condition. 42. Taking an antibiotic for viral infection is generally recommended to speed up recovery. True or false? Answer: false. Rational. Antibiotics are ineffective against viral infections and should only be prescribed for bacterial infections to avoid antibiotic resistance. 43. Digoxin should be administered with caution in patients with hypokalemia. True or false? Answer: true. Rational. Hypokalemia can increase the risk of digoxin toxicity as low potassium levels enhance digoxin's effect on the heart. 44. Patients who are prescribed clopidogrel should be instructed to avoid aspirin to prevent excessive bleeding. True or false? Answer: false. Rational. Clopidogrel and aspirin are often used together to prevent blood clots in patients with cardiovascular conditions, but the combination should be closely monitored for bleeding risks. 45. Oral contraceptives can reduce the effectiveness of antibiotics. True or false? Answer: true. Rational. Some antibiotics can reduce the effectiveness of oral contraceptives by affecting their metabolism, leading to an increased risk of pregnancy. 46. Beta blockers should be abruptly stopped if a patient experiences side effects. True or false? Answer: false. Rational. Beta blockers should be tapered off gradually to avoid rebound hypertension or tachycardia. Abrupt discontinuation can lead to withdrawal symptoms. 47. Antipsychotic medications can be used to manage symptoms of depression in all patients. True or false? Answer: false. Rational. Antipsychotics are primarily used to treat conditions like schizophrenia and bipolar disorder. They are not first-line treatment for depression, except in certain cases like treatment-resistant depression. 48. Statins are typically prescribed to reduce LDL cholesterol levels. True or false? Answer: true. Rational. Statins inhibit HMG-CoA reductase, a key enzyme in cholesterol production, which helps lower LDL cholesterol and reduce the risk of cardiovascular events. 49. Warfarin and aspirin can be safely combined to prevent deep vein thrombosis, DVT. True or false? Answer: false. Rational. Combining warfarin and aspirin increases the risk of bleeding, so this combination should be avoided unless specifically indicated and monitored by a healthcare provider. 50. Antihistamines are safe for patients with glaucoma. True or false? Answer: false. Rational. Antihistamines can cause pupil dilation, which can increase intraocular pressure and worsen glaucoma symptoms. 51. Pregnant women should avoid taking ACE inhibitors due to potential harm to the fetus. True or false? Answer: true. Rational. ACE inhibitors are teratogenic and should be avoided during pregnancy due to the risk of fetal harm, especially in the second and third trimesters. 52. Hydrocodone is a non-narcotic pain medication used to treat moderate to severe pain. True or false? Answer: false. Rational. Hydrocodone is an opioid, narcotic, analgesic used to treat moderate to severe pain, and it carries a risk of dependence and addiction. 53. A patient with a history of alcohol abuse should be prescribed lorazepam instead of diazepam for alcohol withdrawal. True or false? Answer: true. Rational. Lorazepam is preferred over diazepam for alcohol withdrawal in patients with a history of alcohol abuse because it has a shorter half-life and is less likely to accumulate in the body. 54. A common side effect of antipsychotic medications is tardive dyskinesia. True or false? Answer: true. Rational. Tardive dyskinesia is a potential long-term side effect of antipsychotic medications, particularly the first-generation antipsychotics, and involves involuntary movements. 55. Lithium is used to treat bipolar disorder and requires regular monitoring of thyroid function. True or false? Answer: true. Rational. Lithium can affect thyroid function, and regular monitoring of thyroid levels is important in patients taking this medication to prevent hypothyroidism. 56. Beta blockers are contraindicated in patients with asthma. True or false? Answer: true. Rational. Beta blockers can cause bronchoconstriction, which can exacerbate asthma symptoms and is generally contraindicated in asthmatic patients. 57. A patient on diuretics should be instructed to consume high-sodium foods to prevent electrolyte imbalances. True or false? Answer: false. Rational. Diuretics can cause electrolyte imbalances, including low sodium levels, hyponatremia, and high-sodium foods should be avoided to prevent worsening of these imbalances. 58. Calcium channel blockers are commonly prescribed to treat hypertension and arrhythmias. True or false? Answer: true. Rational. Calcium channel blockers reduce blood pressure by dilating blood vessels and are also used to treat arrhythmias by slowing the conduction of electrical impulses in the heart. 59. Patients with a history of gastric ulcers should avoid using NSAIDs. True or false? Answer: true. Rational. NSAIDs can irritate the stomach lining and increase the risk of bleeding or ulcer formation, especially in patients with a history of gastric ulcers. 60. Hydroxychloroquine is a medication used to treat malaria, and it is also used for managing lupus and rheumatoid arthritis. True or false? Answer: True. Rational. Hydroxychloroquine is used to treat malaria and is also effective in managing autoimmune conditions like lupus and rheumatoid arthritis due to its anti-inflammatory effects. 61. Calcium supplements should be taken with vitamin D to improve absorption. True or false? Answer: true. Rational. Vitamin D enhances the absorption of calcium in the intestines, making the combination more effective in treating or preventing osteoporosis. 62. Diuretics are commonly used to treat fluid retention and hypertension. True or false? Answer: true. Rational. Diuretics help the kidneys remove excess sodium and water from the body, reducing fluid retention and lowering blood pressure. 63. ACE inhibitors can cause a persistent dry cough in some patients. True or false? Answer: true. Rational. A common side effect of ACE inhibitors is a dry, persistent cough, which occurs in a small number of patients due to the accumulation of bradykinin. 64. Anticoagulant therapy, such as with warfarin, requires regular blood tests to monitor therapeutic levels. True or false? Answer: true. Rational. Warfarin therapy requires regular INR, International Normalized Ratio, testing to ensure therapeutic anticoagulation and minimize the risk of bleeding. 65. It is safe to take multiple non-prescription medications without checking for drug interactions. True or false? Answer: false. Rational. It is important to check for potential drug interactions when taking multiple medications to avoid harmful effects, as interactions can alter the efficacy or safety of drugs. 66. Morphine is a non-narcotic pain reliever commonly used for mild pain. True or false? Answer: false. Rational. Morphine is an opioid narcotic pain reliever used to treat moderate to severe pain, not mild pain. It carries a risk of dependency and side effects. 67. Antacids should be taken at least 1 hour before or after taking other medications to avoid interference with absorption. True or false? Answer: true. Rational. Antacids can alter the pH of the stomach and affect the absorption of other medications, so it is recommended to take them at least 1 hour apart from other drugs. 68. Statins should be taken in the morning to improve their effectiveness. True or false? Answer: false. Rational. Statins are typically taken in the evening because cholesterol production in the liver peaks overnight, and taking statins at night increases their effectiveness. 69. Parenteral administration of vitamin K is the preferred treatment for warfarin overdose. True or false? Answer: true. Rational. In cases of warfarin overdose, vitamin K, often given parenterally, can help reverse the effects of the anticoagulant and restore normal clotting. 70. Medications for tuberculosis should be taken only until symptoms resolve. True or false? Answer: false. Rational. Tuberculosis medications must be taken for the full prescribed duration, typically 6 to 9 months, to prevent the development of drug-resistant tuberculosis. 71. The recommended dose of acetaminophen should not exceed 4,000 milligrams per day to prevent liver damage. True or false? Answer: true. Rational. High doses of acetaminophen can cause severe liver damage. The recommended daily maximum dose is 4,000 milligrams to ensure safety. 72. Beta blockers are used to treat both hypertension and heart failure. True or false? Answer: true. Rational. Beta blockers reduce blood pressure and help improve heart function in patients with heart failure by reducing the heart's workload and preventing arrhythmias. 73. Iron supplements should be taken with dairy products to enhance absorption. True or false? Answer: false. Rational. Dairy products can reduce the absorption of iron. Iron supplements are better absorbed when taken with vitamin C-rich foods, such as citrus fruits or juice. 74. Antidepressants should be discontinued abruptly when symptoms of depression improve. True or false? Answer: false. Rational. Discontinuing antidepressants abruptly can lead to withdrawal symptoms or relapse of depression. They should be tapered under a healthcare provider's guidance. 75. Lithium levels should be monitored regularly due to its narrow therapeutic range. True or false? Answer: true. Rational. Lithium has a narrow therapeutic index, and regular blood tests are necessary to monitor levels and prevent toxicity, which can cause severe side effects. 76. Potassium-sparing diuretics are safe to use in patients with hyperkalemia. True or false? Answer: false. Rational. Potassium-sparing diuretics can increase potassium levels and should be avoided in patients with hyperkalemia or those at risk for it. 77. Clonidine is used primarily to treat hypertension and opioid withdrawal. True or false? Answer: true. Rational. Clonidine is an alpha-2 agonist that helps lower blood pressure and is also used to manage withdrawal symptoms in opioid-dependent patients. 78. Doxycycline is contraindicated in children under 8 years of age due to the risk of teeth discoloration. True or false? Answer: true. Rational. Doxycycline can cause permanent discoloration of teeth in children under 8, so it is typically contraindicated in this age group unless absolutely necessary. 79. Opiates should be administered to patients with a history of substance abuse with great caution. True or false? Answer: true. Rational. Opiates can be highly addictive, and patients with a history of substance abuse are at increased risk of misuse, dependence, and overdose. 80. Epinephrine is used to treat anaphylaxis by constricting blood vessels and dilating airways. True or false? Answer: true. Rational. Epinephrine works by constricting blood vessels to increase blood pressure and dilating airways to ease breathing during anaphylactic reactions. 81. The use of benzodiazepines in elderly patients is considered safe due to their sedative effects. True or false? Answer: false. Rational. Benzodiazepines are not recommended for elderly patients due to the risk of sedation, falls, and confusion. Safer alternatives should be considered. 82. Valproic acid is used to treat bipolar disorder and epilepsy. True or false? Answer: true. Rational. Valproic acid is an anticonvulsant and mood stabilizer used to treat conditions like bipolar disorder and epilepsy by regulating brain activity. 83. Thiazide diuretics can lead to hypokalemia, causing muscle weakness and arrhythmias. True or false? Answer: true. Rational. Thiazide diuretics can cause excessive potassium loss, leading to hypokalemia, which increases the risk of muscle weakness, cramps, and arrhythmias. 84. Antibiotic therapy should always be completed as prescribed, even if symptoms resolve early. True or false? Answer: true. Rational. Completing the full course of antibiotics is essential to ensure the infection is fully treated and to prevent antibiotic resistance. 85. Patients on methotrexate therapy should avoid taking folic acid supplements. True or false? Answer: false. Rational. Folic acid is often given alongside methotrexate to reduce the risk of side effects like mouth sores and gastrointestinal issues. 86. Proton pump inhibitors, PPIs, are commonly used for short-term relief of heartburn and ulcers. True or false? Answer: true. Rational. PPIs reduce gastric acid production and are effective for managing heartburn, GERD, and peptic ulcers. However, long-term use can increase the risk of bone fractures and infections. 87. Antibiotic resistance can occur when antibiotics are overused or misused. True or false? Answer: true. Rational. Overuse or misuse of antibiotics can lead to the development of antibiotic-resistant bacteria, making infections harder to treat. 88. Insulin should be administered as soon as blood glucose levels exceed 200 milligrams per deciliter. True or false? Answer: false. Rational. Insulin should be administered based on the patient's individualized insulin regimen and blood glucose levels, but the exact threshold may vary depending on the treatment plan. 89. Lithium is contraindicated in patients with renal impairment because it is primarily excreted by the kidneys. True or false? Answer: true. Rational. Lithium is excreted through the kidneys, and in patients with renal impairment, the drug can accumulate to toxic levels, leading to potential side effects. 90. Tetracyclines can cause photosensitivity, making patients more prone to sunburns. True or false? Answer: true. Rational. Tetracycline antibiotics can increase the skin's sensitivity to sunlight, increasing the risk of sunburn or other skin reactions. 91. Tetracycline should not be taken with dairy products because they can reduce absorption. True or false? Answer: true. Rational. Dairy products contain calcium, which can bind to tetracyclines, reducing their absorption and effectiveness. 92. The use of acetaminophen is recommended for patients with liver disease. True or false? Answer: false. Rational. Acetaminophen is metabolized by the liver, and in patients with liver disease, it can increase the risk of liver toxicity. 93. A patient taking warfarin should avoid foods rich in vitamin K. True or false? Answer: true. Rational. Vitamin K can interfere with the action of warfarin, reducing its anticoagulant effect, so patients should maintain a consistent intake of vitamin K. 94. Alcohol consumption can increase the sedative effects of benzodiazepines. True or false? Answer: true. Rational. Alcohol can enhance the sedative and depressant effects of benzodiazepines, increasing the risk of respiratory depression and overdose. 95. Metformin should be discontinued prior to surgery to reduce the risk of lactic acidosis. True or false? Answer: true. Rational. Metformin should be temporarily discontinued before surgery or procedures requiring contrast media to reduce the risk of lactic acidosis, especially in patients with kidney impairment. 96. Corticosteroids can cause hyperglycemia in diabetic patients. True or false? Answer: true. Rational. Corticosteroids can increase blood sugar levels by promoting gluconeogenesis, which can exacerbate hyperglycemia, especially in diabetic patients. 97. The use of aspirin is contraindicated in children under 12 years of age due to the risk of Reye's syndrome. True or false? Answer: true. Rational. Aspirin use in children under 12 years of age is contraindicated due to the risk of Reye's syndrome, a rare but serious condition that causes liver and brain damage. 98. Patients receiving digoxin should have their heart rate monitored regularly. True or false? Answer: true. Rational. Digoxin affects heart rate, and it is important to monitor pulse rate to avoid bradycardia and potential toxicity. A heart rate below 60 bpm should be reported to the provider. 99. A common side effect of corticosteroids is weight loss. True or false? Answer: false. Rational. Corticosteroids often cause fluid retention, increased appetite, and weight gain, not weight loss. 100. The therapeutic range of phenytoin dilantin must be monitored to avoid toxicity. True or false? Answer: true. Rational. Phenytoin has a narrow therapeutic range, and levels must be regularly monitored to avoid toxicity, which can cause neurological damage. 101. Statins should be taken with food to reduce gastrointestinal side effects. True or false? Answer: true. Rational. Taking statins with food can help reduce gastrointestinal side effects, such as nausea and stomach upset, and improve overall tolerability. 102. Non-steroidal anti-inflammatory drugs, NSAIDs, should be used cautiously in patients with renal disease. True or false? Answer: true. Rational. NSAIDs can impair renal function by inhibiting prostaglandins, which are important for maintaining kidney blood flow. They should be used cautiously in patients with renal disease. 103. Patients taking diuretics should be monitored for hyperkalemia. True or false? Answer: false. Rational. Some diuretics, especially potassium-sparing diuretics, can cause hyperkalemia, but thiazide and loop diuretics typically cause hypokalemia, necessitating potassium monitoring. 104. The primary purpose of warfarin is to prevent clot formation. True or false? Answer: true. Rational. Warfarin is an anticoagulant that works by inhibiting vitamin K-dependent clotting factors, thereby preventing blood clot formation. 105. Patients taking lithium should maintain adequate fluid intake to prevent toxicity. True or false? Answer: true. Rational. Lithium levels can increase with dehydration, leading to toxicity. Adequate fluid intake is essential to maintain a therapeutic range and prevent side effects. 106. All NSAIDs have the same risk of gastrointestinal bleeding. True or false? Answer: false. Rational. While all NSAIDs carry some risk of gastrointestinal bleeding, the risk varies among them. Some, like ibuprofen, have a lower risk than others, like ketorolac. 107. Nitroglycerin should be stored in a light-resistant container to preserve its potency. True or false? Answer: true. Rational. Nitroglycerin is sensitive to light and should be stored in a light-resistant container to prevent degradation and loss of potency. 108. Lisinopril is a type of angiotensin-converting enzyme, ACE, inhibitor. True or false? Answer: true. Rational. Lisinopril is an ACE inhibitor that works by blocking the enzyme responsible for converting angiotensin I to angiotensin II, reducing blood pressure and improving heart function. 109. Antihistamines are typically used to treat bacterial infections. True or false? Answer: false. Rational. Antihistamines are used to treat allergic reactions and symptoms like sneezing and itching, but they are not effective for bacterial infections. 110. Warfarin should be taken at the same time every day to maintain stable therapeutic levels. True or false? Answer: true. Rational. Taking warfarin at the same time each day helps maintain stable therapeutic levels and reduces the risk of under- or overdosing. 111. The use of benzodiazepines in the elderly population is generally recommended for long-term anxiety management. True or false? Answer: false. Rational. Benzodiazepines are generally avoided in the elderly due to the risk of sedation, confusion, falls, and dependence. Non-pharmacological treatments are preferred for long-term anxiety management. 112. Beta blockers are contraindicated in patients with asthma due to the risk of bronchoconstriction. True or false? Answer: true. Rational. Beta blockers can cause bronchoconstriction by blocking beta-2 receptors in the lungs, making them contraindicated in patients with asthma or other respiratory conditions. 113. The combination of a beta blocker and calcium channel blocker should be avoided in patients with heart failure. True or false? Answer: true. Rational. Combining beta blockers and calcium channel blockers can further decrease heart rate and contractility, which can worsen heart failure symptoms. 114. The use of high doses of acetaminophen can lead to renal toxicity. True or false? Answer: false. Rational. High doses of acetaminophen primarily cause liver toxicity, not renal toxicity, and should be used cautiously, especially in patients with liver impairment. 115. Diuretics are effective in treating both high blood pressure and edema. True or false? Answer: true. Rational. Diuretics work by promoting fluid excretion through the kidneys, which helps lower blood pressure and reduce edema. 116. Anticholinergic medications are used to treat urinary incontinence by relaxing the bladder muscle. True or false? Answer: true. Rational. Anticholinergic medications block acetylcholine, reducing involuntary bladder contractions and helping control urinary incontinence. 117. The primary side effect of thiazide diuretics is hyperkalemia. True or false? Answer: false. Rational. Thiazide diuretics commonly cause hypokalemia as they promote potassium excretion along with sodium and water. 118. Patients on anticoagulant therapy should be advised to limit their intake of green leafy vegetables. True or false? Answer: true. Rational. Green leafy vegetables are rich in vitamin K, which can interfere with the anticoagulant effects of warfarin, making it important for patients to maintain consistent intake. 119. Metoclopramide is commonly used to treat nausea and vomiting by increasing gastric motility. True or false? Answer: true. Rational. Metoclopramide increases gastric motility and promotes gastric emptying, which can help alleviate nausea and vomiting. 120. Antidepressant medications, such as SSRIs, should be tapered slowly when discontinued to prevent withdrawal symptoms. True or false? Answer: true. Rational. Abrupt discontinuation of SSRIs can lead to withdrawal symptoms such as dizziness, headache, and irritability. Tapering the dose gradually can minimize these effects. 121. All anti-diabetic medications work by increasing insulin production. True or false? Answer: false. Rational. Different anti-diabetic medications work through various mechanisms, such as increasing insulin sensitivity, reducing glucose production in the liver, or stimulating insulin release, but not all increase insulin production. 122. Patients on anticoagulant therapy should avoid taking over-the-counter pain relievers like ibuprofen. True or false? Answer: true. Rational. NSAIDs like ibuprofen can increase the risk of bleeding in patients on anticoagulant therapy due to their effect on platelet function and gastrointestinal irritation. 123. The use of angiotensin-converting enzyme inhibitors, ACE inhibitors, may cause a persistent dry cough. True or false? Answer: true. Rational. A common side effect of ACE inhibitors is a persistent dry cough due to the accumulation of bradykinin, which is not broken down in the lungs. 124. Antipsychotic medications are used primarily for the treatment of schizophrenia. True or false? Answer: true. Rational. Antipsychotic medications are commonly used to manage symptoms of schizophrenia by blocking dopamine receptors in the brain, reducing psychotic symptoms. 125. The administration of potassium supplements is recommended for patients receiving furosemide, Lasix, to prevent hypokalemia. True or false? Answer: true. Rational. Furosemide is a loop diuretic that increases potassium excretion, so potassium supplementation is necessary to prevent hypokalemia in patients receiving this medication. 126. Levothyroxine should be taken with food to improve absorption. True or false? Answer: false. Rational. Levothyroxine should be taken on an empty stomach, typically 30 minutes before breakfast, as food can reduce its absorption. 127. Medications like beta blockers can be used to manage both hypertension and anxiety. True or false? Answer: true. Rational. Beta blockers reduce heart rate and blood pressure, which can help manage symptoms of anxiety, such as tachycardia and tremors. 128. Inhaled corticosteroids are used to reduce inflammation in the airways for patients with asthma. True or false? Answer: true. Rational. Inhaled corticosteroids are used to control chronic inflammation in the airways of asthma patients, reducing the frequency and severity of asthma attacks. 129. The patient should be advised to avoid grapefruit juice while taking calcium channel blockers. True or false? Answer: true. Rational. Grapefruit juice can inhibit the metabolism of calcium channel blockers, leading to increased drug levels and a higher risk of side effects like hypotension. 130. Methotrexate is commonly used to treat rheumatoid arthritis and some cancers. True or false? Answer: true. Rational. Methotrexate is a disease-modifying antirheumatic drug, DMARD, used to treat rheumatoid arthritis and certain types of cancer by inhibiting cell growth and reducing inflammation. 131. Propranolol is contraindicated in patients with asthma due to its potential to cause bronchospasm. True or false? Answer: true. Rational. Propranolol is a non-selective beta blocker that can cause bronchospasm by blocking beta-2 receptors in the lungs, making it contraindicated in patients with asthma. 132. Statins should be taken at night for optimal cholesterol-lowering effects. True or false? Answer: true. Rational. Statins are most effective when taken at night because cholesterol synthesis occurs primarily during sleep, and statins inhibit this process. 133. Lithium is commonly used in the treatment of bipolar disorder. True or false? Answer: true. Rational. Lithium is a mood stabilizer used to treat the manic and depressive episodes of bipolar disorder by affecting neurotransmitter activity in the brain. 134. A common side effect of opioid analgesics is constipation. True or false? Answer: true. Rational. Opioid analgesics can slow gastrointestinal motility, leading to constipation, which is a common side effect. 135. The nurse should administer antihypertensive medications even if the patient's blood pressure is within the normal range. True or false? Answer: false. Rational. Antihypertensive medications should only be administered based on the patient's current blood pressure, as administering them when the blood pressure is already normal could lead to hypotension. 136. Doxycycline should be avoided in pregnant women due to the potential risk of tooth discoloration in the fetus. True or false? Answer: true. Rational. Doxycycline is a tetracycline antibiotic that can cross the placenta and cause permanent tooth discoloration in the developing fetus, so it is contraindicated during pregnancy. 137. Diuretics can be used to treat both high blood pressure and fluid retention. True or false? Answer: true. Rational. Diuretics are effective for managing both hypertension and fluid retention, edema, by promoting fluid excretion through the kidneys. 138. Theophylline is a bronchodilator used to treat asthma and chronic obstructive pulmonary disease, COPD. True or false? Answer: true. Rational. Theophylline is a methylxanthine drug that acts as a bronchodilator by relaxing the muscles around the airways, helping to treat asthma and COPD. 139. Nitroprusside is used to treat hypertensive crises by dilating blood vessels. True or false? Answer: true. Rational. Nitroprusside is a potent vasodilator used to rapidly lower blood pressure in hypertensive emergencies or crises. 140. Antidepressants, such as SSRIs, can increase the risk of suicidal thoughts in adolescents. True or false? Answer: true. Rational. SSRIs can increase the risk of suicidal thoughts and behaviors in children and adolescents, so careful monitoring is required during the early stages of treatment. 141. Phenytoin should be administered through a filter when given intravenously. True or false? Answer: true. Rational. Phenytoin should be given with a filter to avoid the precipitation of crystals that can occur during administration. 142. Nonsteroidal anti-inflammatory drugs, NSAIDs, can cause kidney damage when used long-term. True or false? Answer: true. Rational. Long-term use of NSAIDs can impair kidney function by inhibiting prostaglandins, which are important for maintaining renal blood flow. 143. Acyclovir is commonly used to treat bacterial infections. True or false? Answer: false. Rational. Acyclovir is an antiviral medication used to treat infections caused by herpes viruses, not bacterial infections. 144. Antihistamines should be used cautiously in elderly patients due to their sedative effects. True or false? Answer: true. Rational. Antihistamines, particularly first-generation ones, have sedative effects that can increase the risk of falls and confusion in elderly patients. 145. Folic acid supplementation is recommended for pregnant women to prevent neural tube defects. True or false? Answer: true. Rational. Folic acid supplementation is recommended before and during pregnancy to help prevent neural tube defects in the developing fetus. 146. Morphine is a non-opioid analgesic commonly used to treat moderate to severe pain. True or false? Answer: false. Rational. Morphine is an opioid analgesic, not a non-opioid analgesic, and is used to treat moderate to severe pain. 147. Diuretics can be used to treat high blood pressure by reducing blood volume. True or false? Answer: true. Rational. Diuretics reduce blood volume by increasing urine output, which helps lower blood pressure in patients with hypertension. 148. Taking acetaminophen at high doses for prolonged periods can lead to liver damage. True or false? Answer: true. Rational. High doses or prolonged use of acetaminophen can overwhelm the liver's detoxification ability, leading to liver damage and toxicity. 149. Clopidogrel is used to prevent blood clots in patients with cardiovascular conditions. True or false? Answer: true. Rational. Clopidogrel is an antiplatelet medication that inhibits platelet aggregation to reduce the risk of blood clot formation in patients with cardiovascular disease. 150. Antacids can reduce the effectiveness of certain antibiotics by interfering with their absorption. True or false? Answer: true. Rational. Antacids can alter the pH of the stomach, which can reduce the absorption of certain antibiotics, such as tetracyclines and fluoroquinolones. 151. Metformin is commonly used to treat type 1 diabetes. True or false? Answer: false. Rational. Metformin is used to treat type 2 diabetes by improving insulin sensitivity and reducing hepatic glucose production. It is not typically used for type 1 diabetes. 152. A patient taking warfarin should avoid foods high in vitamin K, such as spinach. True or false? Answer: true. Rational. Vitamin K can antagonize the effects of warfarin, which is an anticoagulant, so patients are advised to avoid large amounts of vitamin K-rich foods like spinach. 153. Beta blockers are commonly used to increase heart rate in patients with bradycardia. True or false? Answer: false. Rational. Beta blockers are used to decrease heart rate, not increase it, and are contraindicated in patients with bradycardia. 154. Insulin is typically injected intramuscularly for faster absorption. True or false? Answer: false. Rational. Insulin is usually administered subcutaneously, not intramuscularly, to allow for slow and steady absorption. 155. Diltiazem is a calcium channel blocker used to treat hypertension and angina. True or false? Answer: true. Rational. Diltiazem is a calcium channel blocker that works by relaxing blood vessels and decreasing heart rate, making it effective in treating hypertension and angina. 156. Antihistamines can be used to treat allergies, but they may cause drowsiness. True or false? Answer: true. Rational. First-generation antihistamines are known to cause drowsiness as a side effect, although newer-generation antihistamines are less sedating. 157. Lithium toxicity can occur when the blood level exceeds the therapeutic range of 0.6 to 1.2 milliequivalent/L. True or false? Answer: true. Rational. Lithium toxicity can occur when levels exceed the therapeutic range, leading to symptoms such as nausea, tremors, and confusion. 158. It is safe for patients on digoxin to take other medications without concern for drug interactions. True or false? Answer: false. Rational. Digoxin has a narrow therapeutic index, and many medications, especially those affecting electrolyte balance, can interact with digoxin, increasing the risk of toxicity. 159. Ceftriaxone is a third-generation cephalosporin that is effective against both gram-positive and gram-negative bacteria. True or false? Answer: true. Rational. Ceftriaxone is a broad-spectrum third-generation cephalosporin that is effective against a wide range of both gram-positive and gram-negative bacteria. 160. The patient should drink plenty of fluids while taking diuretics to avoid dehydration. True or false? Answer: true. Rational. Diuretics increase urine output, so it is important for patients to maintain hydration to prevent dehydration and electrolyte imbalances. 161. Ibuprofen is a corticosteroid used to reduce inflammation. True or false? Answer: false. Rational. Ibuprofen is an NSAID, non-steroidal anti-inflammatory drug, used to reduce inflammation and pain, not a corticosteroid. 162. Theophylline is used to treat asthma and COPD by relaxing the smooth muscles in the airways. True or false? Answer: true. Rational. Theophylline is a bronchodilator that works by relaxing smooth muscle in the airways, helping to improve airflow in conditions like asthma and COPD. 163. Rifampin can cause urine, sweat, and tears to turn a red-orange color. True or false? Answer: true. Rational. Rifampin, an antibiotic, can cause bodily fluids like urine, sweat, and tears to turn a red-orange color, which is harmless, but a known side effect. 164. Antacids should be taken immediately after meals to neutralize stomach acid. True or false? Answer: false. Rational. Antacids are typically taken 1 to 2 hours after meals to help neutralize stomach acid and provide relief from symptoms like heartburn or acid reflux. 165. Acetaminophen, Tylenol, is an effective anti-inflammatory drug. True or false? Answer: false. Rational. Acetaminophen is an analgesic and antipyretic, but it does not have significant anti-inflammatory effects like NSAIDs. 166. Benzodiazepines should be used for long-term management of anxiety disorders. True or false? Answer: false. Rational. Benzodiazepines are effective for short-term anxiety management, but are not recommended for long-term use due to the risk of dependence and tolerance. 167. Metoprolol is a beta blocker used to treat high blood pressure and heart failure. True or false? Answer: true. Rational. Metoprolol is a selective beta blocker that reduces heart rate and blood pressure and is commonly used in the management of hypertension and heart failure. 168. Furosemide, Lasix, can cause potassium retention, increasing the risk of hyperkalemia. True or false? Answer: false. Rational. Furosemide is a loop diuretic that causes potassium excretion, not retention, which can lead to hypokalemia. 169. Nitrates are used to relieve chest pain by dilating blood vessels and improving blood flow to the heart. True or false? Answer: true. Rational. Nitrates, such as nitroglycerin, relax and dilate blood vessels, increasing blood flow to the heart and helping to relieve chest pain and angina. 170. Acetylcysteine is used to treat acetaminophen overdose by replenishing glutathione in the liver. True or false? Answer: true. Rational. Acetylcysteine is an antidote for acetaminophen overdose. It works by replenishing glutathione, which helps detoxify the liver. 171. Thiazide diuretics are the first-line treatment for heart failure and are commonly used for managing hypertension. True or false? Answer: true. Rational. Thiazide diuretics are commonly used to treat both heart failure and hypertension by reducing fluid retention and lowering blood pressure. 172. Clonidine is a medication that works by stimulating alpha-2 receptors to decrease blood pressure. True or false? Answer: true. Rational. Clonidine is an alpha-2 adrenergic agonist that reduces blood pressure by inhibiting sympathetic nervous system activity. 173. Corticosteroids should be abruptly discontinued to avoid adrenal insufficiency. True or false? Answer: false. Rational. Corticosteroids should be tapered off gradually to avoid adrenal insufficiency, as abrupt discontinuation can lead to a life-threatening condition. 174. Glucocorticoids can increase blood sugar levels in diabetic patients. True or false? Answer: true. Rational. Glucocorticoids can cause hyperglycemia by increasing glucose production in the liver and decreasing insulin sensitivity, which is particularly concerning for diabetic patients. 175. The patient should be instructed to avoid consuming alcohol while taking disulfiram, antabuse. True or false? Answer: true. Rational. Disulfiram causes severe reactions, such as nausea and vomiting, when alcohol is consumed, so patients are advised to avoid alcohol during treatment. 176. Warfarin can be safely used during pregnancy for the treatment of venous thromboembolism. True or false? Answer: false. Rational. Warfarin is contraindicated during pregnancy due to its teratogenic effects. Heparin is the preferred anticoagulant in pregnancy. 177. The use of a proton pump inhibitor, PPI, can increase the risk of Clostridium difficile, C. diff, infections. True or false? Answer: true. Rational. PPIs reduce stomach acid, which can increase the risk of gastrointestinal infections, including C. diff, by allowing bacteria to survive in the gut. 178. Sildenafil, Viagra, should not be taken with nitrates due to the risk of a life-threatening drop in blood pressure. True or false? Answer: true. Rational. Sildenafil and nitrates both cause vasodilation, and when taken together, they can result in severe hypotension, which can be life-threatening. 179. Vancomycin is used to treat infections caused by gram-negative bacteria. True or false? Answer: false. Rational. Vancomycin is effective against gram-positive bacteria, including MRSA, but it is not effective against gram-negative organisms. 180. Proton pump inhibitors, PPIs, are used to treat peptic ulcers by decreasing gastric acid production. True or false? Answer: true. Rational. PPIs reduce the production of gastric acid, which helps heal peptic ulcers and prevents their recurrence. 181. A patient receiving insulin should check their blood sugar levels regularly to avoid hypoglycemia. True or false? Answer: true. Rational. Regular blood glucose monitoring is essential for insulin-treated patients to ensure blood sugar levels are maintained within a safe range and to avoid hypoglycemia. 182. Statins are used to lower cholesterol levels and reduce the risk of cardiovascular events. True or false? Answer: true. Rational. Statins are commonly prescribed to lower LDL cholesterol levels, which helps reduce the risk of heart attacks, strokes, and other cardiovascular issues. 183. The nurse should avoid administering ibuprofen to a patient with a history of peptic ulcers. True or false? Answer: true. Rational. Ibuprofen and NSAID can irritate the stomach lining and increase the risk of gastrointestinal bleeding in patients with a history of peptic ulcers. 184. Penicillin is contraindicated in patients who have an allergy to cephalosporins. True or false? Answer: true. Rational. Cephalosporins and penicillins share a similar structure, and cross-reactivity between the two drugs may lead to allergic reactions in sensitive patients. 185. Antacids should be taken at least 1 hour after other medications to avoid drug interactions. True or false? Answer: true. Rational. Antacids can interfere with the absorption of many medications, so it is recommended to take them at least 1 hour apart from other drugs. 186. Theophylline levels need to be monitored closely in patients with asthma because of its narrow therapeutic range. True or false? Answer: true. Rational. Theophylline has a narrow therapeutic range, and its levels can easily become toxic, so regular monitoring is necessary to prevent adverse effects. 187. A patient taking warfarin should avoid all leafy green vegetables due to vitamin K content. True or false? Answer: false. Rational. While warfarin interacts with vitamin K, patients do not need to completely avoid leafy greens. They should maintain a consistent intake of vitamin K-rich foods. 188. The use of acetaminophen, Tylenol, should be limited in patients with liver disease. True or false? Answer: true. Rational. Acetaminophen is metabolized in the liver, and excessive use can lead to liver damage, so it should be used cautiously in patients with liver disease. 189. Clopidogrel, Plavix, is a blood thinner used to prevent blood clots after surgery. True or false? Answer: true. Rational. Clopidogrel is an antiplatelet drug that prevents blood clots by inhibiting platelet aggregation, commonly used after surgeries like stent placement. 190. Furosemide, Lasix, can cause hypokalemia due to its diuretic effect. True or false? Answer: true. Rational. Furosemide is a loop diuretic that promotes the excretion of potassium along with water and sodium, increasing the risk of hypokalemia. 191. Digoxin is used to increase the heart rate in patients with atrial fibrillation. True or false? Answer: false. Rational. Digoxin is used to slow the heart rate in patients with atrial fibrillation by increasing vagal tone and decreasing conduction through the AV node. 192. Lorazepam, Ativan, is a short-acting benzodiazepine used for anxiety. True or false? Answer: true. Rational. Lorazepam is a short-acting benzodiazepine that is often used for the short-term management of anxiety and for its sedative effects. 193. Epinephrine should be administered intramuscularly in cases of anaphylactic shock. True or false? Answer: true. Rational. Epinephrine is the first-line treatment for anaphylaxis, and it is typically administered intramuscularly to rapidly reverse symptoms like airway constriction and hypotension. 194. Metoclopramide, Reglan, is used to treat constipation by increasing gastrointestinal motility. True or false? Answer: true. Rational. Metoclopramide is a prokinetic agent that stimulates gastric motility and is used to treat conditions like gastroparesis and constipation. 195. Heparin should be administered intravenously for rapid onset of anticoagulant effects. True or false? Answer: true. Rational. Heparin can be given intravenously for rapid anticoagulation, particularly in emergency situations such as acute coronary syndrome. 196. The nurse should withhold acetaminophen if the patient's liver function tests are elevated. True or false? Answer: true. Rational: elevated liver function tests indicate liver damage, and because acetaminophen is metabolized by the liver, it should be withheld to prevent further hepatic injury. 197. The use of antibiotics is always effective in treating viral infections. True or false? Answer: false. Rational: antibiotics are only effective against bacterial infections, not viral infections, which require antiviral treatment if available. 198. Phenytoin dilantin can cause gum hyperplasia and requires regular dental checkups. True or false? Answer: true. Rational: phenytoin, an anticonvulsant, can cause gum hyperplasia, and patients are advised to maintain good oral hygiene and receive regular dental checkups. 199. Insulin should be administered to patients with type 1 diabetes regardless of their food intake. True or false? Answer: true. Rational: patients with type 1 diabetes need to take insulin regardless of food intake to control blood glucose levels since their bodies do not produce insulin. 200. Omeprazole, Prilosec, is a proton pump inhibitor used to reduce gastric acid production in patients with gastroesophageal reflux disease, GERD. True or false? Answer: true. Rational: omeprazole is a proton pump inhibitor that reduces gastric acid production, making it effective for treating GERD and peptic ulcers.